Welcome to the Integration Station. I'm your host, Michael, a child and adolescent occupational therapist, and joining me again today is Edith.
Thank you for having me back.
No worries. And Edith is clinical lead here at Parkside, and we're in the lovely space at Parkside here. Warmer room.
Glasses are slipping.
That's all right. We push on. Some of you may have noticed in the last episode, the T-shirt that I'm wearing, I'm just going to show the brand there. This is the original logo that OTFC did have years ago, and I thought I'd wear it in solidarity to Weymouth. Now that that's finished up, we've closed up there, I thought I'd do a bit of a throwback. What do you think?
Yeah, Weymouth, so many memories from so many people, I think, since hearing that we were going to shut up shop there and open up a few other sites. There's just been so many people sharing different experiences and stories from there, which has been lovely to hear.
Good. Well, it certainly helps me as I didn't have any clean shirts, so lucky I have some of the spare ones here and thought I'd wear this one today.
Vintage, as you said.
Absolutely.
Yeah.
So today we have some questions, and some of these are trickier questions and generally some trickier conversations, I think. But I am certainly of the opinion, and I think you've said this as well, that the more information, the better for our families. And so I think it's worth us having these conversations. There's one here about ABA, which we might get to in a bit. There is another one on the brushing protocol, and we might discuss those ones. But actually first, I thought I'd take the opportunity to just bring forward some chat that's probably more topical. We don't normally go down the path of what's in the current media and what's currently going on, but for those who may be aware, some may not be, but the NDIS recently announced that a number of creative therapies, including music therapy, art therapy, and there's a few others on that list, are not going to receive the funding through NDIS that they once had. And we certainly allies for the other creative therapies and have some friends in that space, and just wanted to take the opportunity to discuss a bit more about music therapy in particular. For those who are long-time listeners of the podcast, I actually did a podcast with creative therapy director Natalie Oliveri last year, I believe. So feel free to go through the back catalogue and have a listen to that. She actually got me singing and clapping along to one of her songs, which was excellent. But that gives you a really good insight into music therapy. But just from our perspective, I hear these changes, and sometimes it can be hard as a fellow therapist to hear that the NDIS is bringing in changes to something that was essentially there to support the capacity of a lot of the young and adult people in the service. And the aim of the NDIS was to provide choice.
Yeah.
And so I'm sitting here thinking, okay, who's next? Ultimately, and I think that's the scary thing is I see a service like that being questioned, and then I wonder what could happen next. And I certainly understand there are reasons as to why there are NDIS restrictions and other things happening, and consideration due to budgets. But at the same time, I also see that there is choice for people in the service, and this is an evidence-based practice.
Absolutely, and I think when we think about development from a very early age, we know how positive music and sounds and exploring that whole field can be for childhood development, and it's just so integral that it's quite an interesting topic of conversation at the moment.
And the one thing I'd say is that for ourselves as OTs, we do go through a university degree, and there's undergraduate or postgraduate, and it's the same with music therapy. They go through a rigorous education to be able to practice as music therapists. And I think that in itself provides a very clear insight into it's an established profession, and it is something that has a peak body, similar to ourselves, OTs or physios or any other sort of allied health. There is a lot of time and effort that goes into that field. And I think this is, just from my perspective, an example of maybe a service being misunderstood, and hopefully there will be outcomes that support the service to ensure that so many people that have had positive impacts from therapy can continue to engage in it.
Yeah, can continue to access it without, maybe foregoing something else that is equally as important.
Yeah, and I mean, I personally have had clients who've accessed the service, who've accessed music therapy, and been able to do things they weren't able to do before because of the therapy itself. So just wanted to point that one out, I think, in this episode in particular. And whilst there is still a lot there to be done, we certainly hope that there will be some positive outcomes from that. One more thing I will say, though, is that there is I think it's a change.org petition that people can sign just to get more awareness of music therapy, get it across the line. I think there are meetings with Bill Shorten and some other things there, and that is encouraging. So from what I'm hearing, some positive things there. But if you absolutely want to do that, there's a change.org petition, and you can look that up for signing that for music therapy. So one thing that I did want to talk about as well today, so the next couple of questions have some, I guess, they're almost tangential to what we have done as in our field of OT. One of them is Therapressure Brushing. So the question here is perspective on Therapressure Brushing. Is it good, and how do I get certified? So this question comes from an OT. So I have had experience in the Therapressure Brushing, and there are a number of different terms. So you might see it as, I think it's DPPT or Therapressure Protocol or Willbarger Protocol, and it's a brushing protocol or technique devised by an OT called Patricia Willbarger, who actually came from an air sensory integration background. So before ASI with the air sensory integration registered trademark came in, there were OTs that studied sensory integration as the main sort of form of sensory-based OT. And she came from that group of people. So she spent some time working with some of the head honchos, as we call them now, or the Avengers, I think our director likes to refer to them as, in air sensory integration. Spent some time working with them, and then sort of branched off into her own space, and through that devised a protocol called the Willbarger Brushing Protocol. So that's a bit of a history about it. I have had some training in that. Yep. I'm familiar with it. I don't use it very often, but I know of it. Yeah. What's your experience with it?
I have been around other therapists who have used it before. I don't have the training in it. I definitely have parents asking about it. So I guess my experience is more from other therapists or families who are inquiring. My understanding is that if you are going to do it, you need to be trained in the specific way, and it is quite rigorous in that way. And if you aren't doing it properly, then perhaps you won't see those outcomes. Would I be correct in saying that?
Yeah, absolutely. I think that's where it comes down to. It is a protocol. It is an approach. Like anything, it's very regimented and it needs to be done a particular way. I don't use it very often, but I do know that some people have had really good success with it. So for those at home who may be watching, sorry for the ones that are listening, I think I do way too much physical stuff for a podcast, but that's okay. This is a brushing protocol. You have to be using your hands.
Yes.
Okay. So, but there is a specific Therapressure brush, and you buy that brush because it has a particular set of bristles on it, and it has to be used in a particular way. And so the protocol, for those that have been trained in it, has to be, the brush has to be pushed in certain directions, a particular force, and you're shown how to do that. Then in addition to this brushing protocol, it happens all over the body. There's parts all over the body that get brushed a particular way. And then there are these joint compressions. And the main aim of the process is to desensitize the body to touch. So it's really designed to work for tactile defensive people.
Yeah.
I've had some people use it and it's worked really effectively. And I've had some people use it for years and nothing has changed. And I think, like any approach, it's very up to that person. I could, even though the question's not in here, I could throw in things like listening program and therapeutic listening and those approaches, which I've had people have really good success with. And again, that's another approach that's used. And in that, the protocols have to be adhered to. And I think this is what can be really hard for families of young people is that it's really tricky to adhere to those protocols all the time, and therefore the results aren't always as they would like. But I don't use it, but I'm not saying it's not effective. I just don't really use it.
Yeah, and I've probably heard of one or two people who have had the time and the capacity to be able to follow that protocol, and it does take time. It is, I guess, a commitment that you're buying into if you are going to do it. And I've heard of one really positive success story, but I guess here in the therapy that we do, we might work to support some of that tactile defensiveness in other ways, whether or not it's a compensatory technique or it's supporting their nervous system to feel regulated around touch. And so we spoke about choice before. It's probably the family working out what works best for them and what works best for their child, and whether it's the first choice that they have or they look into it later down the track. I think that's, an open conversation.
So the only other thing that was raised in the question was certification. My own experience, I was trained by someone who had been shown the method, who was also trained by someone who had been shown the method. I actually really did a quick Google search because I don't use it very often, but I did a quick Google search looking for certification, and I don't know, maybe I wasn't looking in the right places, but I actually couldn't find anywhere which said this is where you get certified to do it. There is a process, there is a protocol where you can have a look at that, and it does say in there you need to be doing this if you're trained in that approach. But apologies to the listener, I found it hard to find anywhere to get that certification, which to me is not an indication it's not effective, but just maybe that not as many people are doing it, or maybe it's not as easy to access as it once was.
But you're saying that perhaps somebody that is trained in it might be able to support the training going forward?
Yeah, I think so. So maybe it's about reaching out to an experienced sensory integration OT who's maybe been in the field for a while or is quite aware of the different processes. They might have a bit more of an idea of the protocol and if they're trained to use it. So the last question we had, and I did want to, as mentioned before, I did want to touch on it, is about ABA. ABA standing for Applied Behaviour Analysis. It's a very different approach to what we do as sensory integration-based OTs, but it is a very common and often considered a gold standard therapy approach. The question we had was, I'm an OT and have seen harm done in ABA. How is a professional way to steer parents away from ABA? As a professional myself, I do understand that there are different approaches that different therapists take. I do find it very hard to completely steer someone away from something, given that potentially for those people, that family, a method has been effective. And I do know that there are stories of ABA being quite impactful, particularly for a lot of the neurodivergent community that are adults that had experiences in the past with that approach, that have come out in years later and said this was quite impactful for me. But there are also a range of them who have also not had that experience. So I think this is where it does become quite tricky to throw a blanket over ABA.
Yeah.
And similar to something like the brushing protocol, I think it does come down to the choice of the family and that young person as well, and how you can support them in making those choices.
Yeah, and I think if we're talking about choice, then it might be that you might need to shop around to find the right, if that was the path you were going down, and your child or young person might be able to lead you as well. You'd be watching how they're responding or how they're creating an engagement with a particular therapist. That might help. I mean, I've had lots of families that have come in and said, look, my child probably wouldn't have been able to engage in other therapies if it weren't for having some ABA therapy to begin with, because that has provided them with some skills that are necessary to be involved in maybe more of a social environment or more of a play-based environment, or maybe supported them to engage in a self-care task just through that really solid repetition. But I think doing the research yourself and making sure that it feels comfortable for you and your family is the biggest factor in helping to make your choice, so that we're ensuring that it's the right one for your young person.
The other thing I'd say about something like ABA is that it's obviously coming from more of a psychology background or a behavioural analysis background, and it's quite well researched, and there's a lot of evidence for it. And I've always been of the opinion that yes, having evidence for a practice is excellent. But I go back to something like alternate therapies that have worked really well for some people, and say the brushing protocol, which has worked for some and not for others. Maybe the evidence base is not as high for that as ABA, but it's worked.
Yeah.
So ABA is very evidence based, but there's obviously been some people that have had different experiences of that. It does come down to choice, I think. And for us to sit here and criticise ABA, and similarly for an ABA therapist to criticise ASI, I think is not really doing anyone in the profession justice, because at the end of the day, people got into their fields practising what they're practising to support the young people in their lives, and there are different ways of doing that. So I would respond to this person and say, rather than steering parents away from ABA, I would certainly encourage them to, as you said, shop around, look for choice. If you are engaged in the therapy and don't feel it's the right choice, it's the same as ASI. If you don't feel that this type of therapy is right for your child, look somewhere else.
So perhaps in that example, it would be not so much steering a parent away from it, but providing them an opportunity to have a really open conversation around what's out there, and supporting the best fit for that particular family.
100%. Well, I'm glad we touched on that. Always good to have some different questions in there, and sometimes the trickier conversations or topics are the most worthwhile to talk about.
Very valuable.
Again, I thank you for jumping in today, Edith. It's
Thank
been
you.
great having you in. Sorry, not that I'm saying I don't love having Eleanor in as well, but it's good to spend some time with you and hear your insights. So questions, if you have them, again, at the top of the episode, mention that you can send them through to OTFC Group on Instagram. Otherwise, podcast@otfcgroup.au. Send them through. We'll answer them. If we get a chance, we'll do a shout out to you if you want that as well.
Yeah.
Otherwise, one more shout out. It's for our little man Fletch, as per normal. Did you want to give him a shout out?
Shout out to you, Fletcher.
All right, and we'll see you all next time. Thanks.
Thank you for having me.